put me on a leash this morning. Okay, guess I'm stuck here. Well, this is great. So I think what's next? What's our why? I think it all starts with a good story, right? There's lots of stories I can tell. I'll let him pull up my slides, but this conference series is just a culmination of many thoughts I had over the last few years on how do we really take the next step. I think I've been challenged by a number of you in the room, from our current clients on, how do we really make this better? I think we've done a really good job in our primary book of business. So before I forget, I do want to thank my entire team for helping set up. So I'll be remiss if I don't do that. And then my wellness team in the back, Danica and Mackenzie, who helped with a variety of things to help organize this. My beloved spouse, Lisa, and the rest of our team here. So I want to give them a quick round of applause. And so I think in this area of the country, we discussed at a variety of best practice events that Matt has hosted and others, that it's one of the highest cost areas for healthcare in our nation, and number 4. In this area, the state itself is right there in the top 2 for healthcare costs. Well, why is that? Well, I think there's a variety of reasons, and I think a lot of people have different answers in this room as to why that is. I think some of it is corporate medicine. We're seeing mergers and acquisitions, but kind of for me, it goes back to residency when seeing people that, in their 20s that were having heart attacks, in their early 30s, and Dr. Liberman's here, and we don't even give people a score on what their 10-year risk score is for atherosclerotic cardiovascular disease, which is heart disease and stroke until they're 40 years old, right? And so how can we make an impact on people that are having problems prior to 40? And then so the system is not designed for wellness, for investing in lifestyle medicine. It's designed for sick care. There's a variety of folks in the room that are involved in the benefit plan design. To me, that's fascinating. I have a very eclectic interest in medicine. And you look at the claims on claims files, and really it's the same things that we see in the country that kill Americans. It's the top 4 you're going to see in a second. So that's really what inspired me to try to rethink how we approach this, because if we don't, you're not going to, what do they say? It's the definition of insanity to do the same thing over and over and over again, right? And so we're not making that difference. Looking at my own journey, so I'm going to sort of stick myself out there. I think it's important to do that when you have a mission to try and improve. I'm a middle-aged guy in America. I'm looking at my cardiometabolic profile for my lipids, my blood pressure, my blood sugar, my fasting blood sugar, and they're all kind of the same as what you see in America. We age, things get worse every year after year. We don't get a diagnosis until we reach a certain number, right? That's how we're treated in American healthcare. When you get to a certain hemoglobin A1C or a certain fasting plasma glucose, then you're pre-diabetic or you're intolerant to glucose. You have a certain lipid profile, and we don't do anything about it until you get to a certain number. And the same thing for blood pressure. And so what happens over time is it continues to get worse. And so we need to look for better ways to approach this. And so my personal journey on neurodegeneration is my own father. So it's a tough one for me because I lost my father a few months ago from Lewy body dementia. And I looked at these pictures, and I'm sure he's proud, but we do not do a good job with dementia treatment in this country. The medications haven't made that much of an impact. They don't return people to a high quality of life. They're expensive. And 99 out of $100 is spent on treatments. Some of the research has been cooked, for lack of a better word, in the last 10, 15 years, and investing in medications just for profit over people. To me, that's tough. And so preventative neurology is kind of a new specialty, just like preventative cardiology. We have to look at ways to not get these diseases, because once we get them, we're in trouble. That's a fact. So how do we do that? And the science here is evolving rapidly. I think there are people that are pushing this in a great way when it comes to lifestyle medicine. So you'll learn about that more in a second here. Lifestyle medicine is based on the 6 pillars, and there's an additional one a colleague of mine recently added. It starts with nutrition, physical activity, restorative sleep, stress reduction, social connection, like we're doing today, and avoiding risky substances, tobacco, alcohol, and other drugs. Lifestyle medicine, it really, to me, is a really rapidly growing field. And we see this on recommendations for diabetes, blood pressure, lipid disorders. Drug companies have it in fine print at the top of their trifolds. They give you to which medication to prescribe. It's always lifestyle medicine's recommended first, but it's in small, tiny print, and nobody really knows how to recommend that or prescribe that, or or give advice for patients and use science to drive those conversations. And so, but that's what lifestyle medicine's here for. So for me, this is a professional society. The American College of Lifestyle Medicine has been in existence for about 15 years. It's rapidly growing. It's picked up 2,000 physician memberships in the last several years alone. And by the fall, I'll be board certified by the American College of Lifestyle Medicine. So it's a professional society that uses science and evidence-based treatments to treat, prevent, and reverse chronic disease. 60 to 80% of our society has a chronic disease, and insulin resistance drives 80% of that. And so that has to be our focus. So this slide is, to me, one of my favorites. And does anyone know what insulin resistance is, besides my practitioners in the room? So to me, this is the rest of my career right here. And I challenge everyone here that you probably have either a personal or a family member or been a patient, and these are going to be in your future in some way, shape, or form. Insulin resistance is related to everything, and it starts with glucose dysregulation, glucose disposal, and as we treat our bodies not the way we were intended to be treated, and eat ultra-processed food, and eat food high in salt, oils, refined carbohydrates, don't eat fiber, we're going to develop insulin resistance. That is your destiny at some level, at some point in your life for most people. We have a major chronic disease problem in this country. So what is insulin resistance? So insulin's a hormone, right? We know that it's secreted from the pancreas. And this is just one interplay of many different things involved in metabolism. And metabolism is the complex process by which we process, store, and use energy. So insulin resistance is insulin is a hormone, and when you have insulin resistance, we have, in this particular slide, we're looking at a skeletal muscle cell. And in the top, you'll see that there are mitochondria inside the cell. The yellow-looking things are intracellular fat, so lipotoxicity. So that is fat, and so when we overconsume fat and consume poor energy, we accumulate fat in our cells. And over time, insulin, which is the key to unlock glucose from coming in the cell, on the bottom right cell diagram, that is a glucose transporter. So there's both what's called active glucose transporters to the surface mediated by insulin, as well in skeletal muscles, also passive glucose transporters that go to the surface and allow glucose in. Skeletal muscle wants energy to be able to function, right? So we need glucose in those cells. When there's insulin resistance, that doesn't work anymore. It's called insulin signaling is dysfunctional. It doesn't open those doors. Glucose doesn't go into the cell. And that's ultimately what happens when you get diabetes. And so when you get hepatic or liver insulin resistance, that's when you develop prediabetes and diabetes. So the liver can no longer see insulin, and it's completely dysregulated, and you have fat, and that's from fat accumulation in these cells, both in the skeletal muscle as well as liver. So what can we do about it? This slide here is kind of tiny. Where's the pointer on here? Sorry, it's hard to read. So these are the cellular signs of aging as we get older, and this is a slide from metformin and how it interacts with a variety of different components in cells. So you get from nutrient dysregulation all the way through mitochondria, telomere attrition, epigenetic alterations, which is what we do to ourselves, as well as cellular senescence, stem cell exhaustion, and abnormal intracellular communication. And all these pathways are mediated by biochemical processes that we learn in medical school in a variety of different science classes. But that, to me, is really where, this is an amazing process that occurs on a moment-to-moment basis, all these things that are happening in these cells. And so we have to make an impact at each one of these if we want to make a difference. So insulin resistance, to me, is that energy issue we talked about. So targeting insulin resistance with lifestyle medicine, to me, is the answer. We have a clinical nutritionist who will take the lead and kind of delve in that a little bit deeper here in a bit. But So everyone likes to hear, like, what's the root cause of the problem, right? Integrative, functional medicine, lifestyle medicine. There's some similarities there and some differences, and I'm not going to go into detail. But if we spend time on investing in the pillars of lifestyle medicine here in a minute, we can make a much bigger impact on our own personal health, as well as the health of your workforces. So this is really a unique opportunity for all of us to work in the benefit space, in the employer space, and in the healthcare provider space to really get that ROI for personal health as well as a health plan and happier, healthier workforce. There's many incredible possibilities here ahead of us.